Hello guys, today I'll be talking on perforator flaps. So I'm going to be talking about the definition, introduction, what perforator flaps are used for, and how they are used in plastic and reconstructive surgery. So join me guys, let's learn this topic. Okay, so if you're a newcomer in my platform, you're welcome. So this is just a platform where I discuss topics on plastic surgery. You're highly welcome. Let's discuss. You can make your comments at the comment section. Drop your comments, drop your questions. If you need any clarification on any topic that I would be talking about or have spoken about, you could drop your message in the comment sections. Thank you very much. So join me as we discuss this topic, perforator flaps. So what are perforator flaps? So they are flaps that consist of subcutaneous tissue, skin with a perforator vessel. So we know what a perforator vessel is. Well, a perforator vessel is a branch of a source artery. So we have the aorta. The aorta has different branches of blood vessels. So when these blood vessels branch out in the region where they are supplying, they have what they further divide to form the perforators. There are about 400 perforators in the body. So these perforator arteries are the ones that supply the skin. So they break out from this major source artery and they could form different perforators from that same vessel. So these perforators, what they do is they could pass through a muscle known as the musculocutaneous perforators, or they could pass through a septum known as the septocutaneous perforators, or they could go directly and enter the deep facial, then the subcutaneous tissue and the skin. So this is the cause of a perforator vessel. So when a perforator vessel gets to the skin, then it can further break down or ramify and then anastomose with vessels from other sources or other perforators. So this perforator flap is a type of flap that has a perforator vessel within it. So it's an Asia pattern flap. I'm trying not to make this talk too long, so I'll just be very fast so that we can actually get the concept of this topic. So these perforator flaps are Asia pattern flap. Asia pattern flap in the sense that they have a named blood vessel that supplies them, and this is what they do. They supply the skin, the subcutaneous tissue, the muscle and things around them. So this concept of perforator flaps initially were not really accepted by plastic surgeons. Why? Because the concept was not well understood. Several people have done research on blood supply to the skin and the vascular territories. So we have skin vascular territory research that was done by Mancho. We have Salmon, who did an anatomic concept of perforators. We have Mattis and Nahi, who did anatomical classification of muscle vessels. Zong, anatomy of septocutaneous vessels. Then we have Croy, who did perforator based flap. Then finally, we have Koshima and Soida, who now did the concept of perforator flaps. So when they did this perforator flap concept, perforator flap, yes. So they harvested this flap and they used it to cover a defect around the mouth. So when they brought out this concept, a lot of surgeons did not buy their idea. Not until after this concept was further discussed in China and also in Gent in Germany. So when this concept was discussed, the researches that were done around it was also discussed in the meeting. Then it gained awareness and people begin to understand it. So to understand perforator arteries, you need to understand the concept of anatomical territories of a blood supply. We need to understand the concept of the angiosome, the perforasomes. So what are angiosomes? Angiosomes are a block of tissue that is supplied by a particular source arteries. Then the angiosome area are the areas that are supplied by these source arteries. So we have a parent vessel that goes to supply a region. It supplies the anatomical territory of that blood of the anatomical territory of that blood. So tissues within that anatomical territory, including the bone, the muscles, the tissues, the subcutaneous tissue, fascia, everything within that territory that is supplied by that skin, that area is the angiosome area. So the angiosome supplies that area, then ends at the point where it anastomosis with other perforator vessels from another parent source. So that area is known as the angiosome area. Then the perforator area is an area that is supplied by a particular perforosome. So with a good understanding of this concept, we can then further move ahead to understand this. So, like I said, perforator flap are flap with that's supplied by a perforator artery. So we have, and it consists of the skin and thin layer of subcutaneous tissue. So we have the layers of the skin, the dermis, the epidermis, the dermis, epidermis. Then we now have the subcutaneous tissue. We have the fascia. So we have the subfascial plexus, the suprafascial plexus. Then we have blood supplies to the subcutaneous tissue. Then we have the subdermal plexus as well. So when we're making our dissection for perforator flaps, we try to avoid the suprafascial region because it has the nerve running through them. So we make a perforator flap thin at the subcutaneous layer in addition with the skin. So that's the skin, the subcutaneous, the thin subcutaneous tissue, as well as the perforator vessel makes up the perforator artery flap. So we have different types. The musculocutaneous, if the perforation, the artery is running through a muscle, then the septocutaneous, the one running through septum. Then we also have the direct ones. So how are these? There are so many perforators in the body. Actually, we have the supraclavicular artery perforators, internal mammary artery perforators, the very common ones, the deep internal epigastric perforators. Then we also have the deep inferior epigastric. Then we have the proximal and the distal. The distal radial artery perforators. Then we also have the anterior medial thigh perforators, which has a very long pedicle and can actually be used to repair defects that occurs in the feet. Then we also have we also have others. There are numerous perforators in the body. So the principle around perforators is the fact that you have to have a very good understanding of the blood supply to the skin and the blood supply to the region, the donor site where you need to take your flap from. So a good understanding of this blood supply is key. Then you want to identify the donor site. You want a donor site that is free from trauma, free from surgery, radiation, so that your wound healing will not be affected. Then you want a donor site that is clean and has a good blood supply. Then the recipient site, you have to examine the recipient site as well, and the area that needs to be covered, the length, the size, so that you can know the amount of flap you need to harvest. Then the nature of the wound. You understand the nature of the wound, the components of the flap. What is the tissue deficit within the wound. Then you have to prepare the wound, allow the wound to granulate, clean up. Then that's as part of the principles for doing a flap normally. Then after that, you now go to the main thing with perforator flaps. Now we need to map the blood vessel. How do we do this? We could do a Doppler, we could do a Doppler or a duplex ultrasound, we could do a CT angiogram or an MRI angiogram. So what we do is we place this probe at the location, the donor site, and we listen to the blood flow and the pulse. So the point where we have the maximum pulse, we map it. So we mark that place. We make it as a center for our perforator flap. So that point is made as a center for our perforator flap. Then it's at that point that we can now draw out the shape, the size of the perforator flap that we want to harvest. Making that point, we've marked the center of our perforator. Then also, as part of the principle, you have to determine what type of perforator flap you're doing. Are you doing a pedicle perforator flap or you're doing a free flap? So that will determine what you're going to do. Then also want to also determine the caliber. So from the Doppler ultrasound, you can determine the size of the size of the vessel based on the flow, the location. Is it intramuscular? Is it intraseptum? Then also if it's going to be favorable, depending on how long you want your pedicle to be. Then for a perforator flap, a good understanding and skill of microsurgery is paramount. Also, intramuscular dissection is very, very important. Why? Because you need to, at the border of your flap, you don't have to cut circumferentially at first. You have to just cut a particular area, just the area, you take a border and incise that border first, dissect through that border until you get to the perforator. So you're targeting perforator arteries that are greater than 0.5 millimeters. So when you dissect carefully, because we want to preserve the donor site. Preserve the donor site. We do not want to cause any morbidity around the donor site. So we dissect, skeletonize this vessel, then we can now shape our flap to the size that we want it to be. Right? So, and this can also determine, and at that point, you can also determine if you want to do a pedicle flap or you want to do a free flap. So for a free flap, you are detaching the vessel completely from that location to go and implant it in another location. And with that, you will need a microvascular anastomosis for this to be done. Then also, perforator flaps they have a good reliability because of the perfusion, the blood flow. They are flexible. Musculocutaneous perforators have long pedicles which can help you manipulate. They are pliable, they are flexible, they are versatile. You can use them for different things. So the uses of perforator flap is enormous. They can be used for breast reconstructive surgeries. Commonly the deep inferior epigastric flap can be used for breast reconstructions. Then also for abdominal surgeries, you can use the superior gluteal artery perforator flaps, can be used for that. Then for head and neck, where you need perforator flap with long pedicles, you can use the anterior lateral tibial artery perforator flaps for this purpose. Then for lower limb reconstructions, you can use the peroneal artery perforator flap. You can use the medial sural perforator flaps for these areas. Then for upper limb and hand, radial artery, you could use the proximal or the distal radial artery perforator flaps as well. Then for pressure injury coverage, you can do the superior gluteal artery perforator, inferior gluteal artery perforator flap, or can be used for any location of the pressure injuries. Then for pediatric and congenital malformation reconstructions, perforator arteries have been found to be used. What's the advantage of perforator arteries? One, it helps to preserve function. So there's a reduced donor site morbidity because the muscles are intact, the dissection is meticulous, and non-traumatic, so it preserves the donor site maximally, right? It preserves the donor site maximally. the function is not lost because the muscle is still in place. There's no so much pain. There's no so much pain, so because the tissues are not traumatized. Then also the precise vascular anatomy is also very good because you're dissecting your flap along with the blood vessel under the guidance of your Doppler or duplex ultrasound that you have done. Then custom design, so you can actually design your perforator artery flap to the the shape that you want, the size that you want, tailor it precisely to your defect because you're not completely cutting at once. You just incise and dissect while looking at your defects to know how much is thinner, is not bulky, so it's contour friendly. Then it can also be harvested in large size with minimal complications. Just like every other flap, is still without complications. So you can have complications like hematoma, infection, as well as blood supply when the pedicle is twisted, the pedicle kinks, or there's excessive stretching. So the challenges with perforator flap is that one, it requires micro surgical skills, then it's time consuming, and it requires a vascular imaging and planning. So perforator flaps are very, very good. They are very, very versatile. They are readily available. With the skill, you can actually go ahead and do your own. You can actually go ahead and do yours. That your own skill is very, very easy to manipulate, and is very, very easy to do. So thank you very much for listening, guys. If there's any contribution you want to make, please put it in the comment section. Any questions, any addition, kindly just write them in the comment sections. Thank you for coming around. Thank you for listening. Bye.